So it's a phenomenal opportunity to even have this conversation, is how can we, or how could we eliminate hepatitis C as a public health problem in that time frame? That's not something that we really ever think about for most diseases. So the progress is amazing and we should be very excited to be doing this, but it's important to remember that elimination is not a simple task. It's not simply figuring out how to treat people and then getting them treated. There are a whole list of things that need to be involved in really developing a proper public health strategy towards elimination. Treatment's for sure a big part of that, but there are a whole bunch of other aspects, from prevention to diagnosis to treatment to follow-up care, and then the probably much bigger picture of managing all of the other social determinants of health that involve many of the individuals living with hepatitis C. And I think sometimes our focus tends to be just a little bit too much on getting treatment. And for sure, access to treatment is a huge thing. We need to have universal access for all people infected, but we need to build this much bigger, broader picture to be able to address hepatitis C at the national level. And the World Health Organization has taken great leadership in calling for this as a goal for elimination by 2030, and one of their key components is they've asked every country to develop a national action plan or a strategy specifically about viral hepatitis. And that creates a problem in a country like Canada, where we have a national union of provinces and territories, but healthcare is a provincial or territorial jurisdiction, and that does create a little bit of a challenge. What does Ottawa have to tell the provinces what they do about delivering healthcare? But I would push back and say there's still a lot of value in a national action plan. It keeps us on track as a country, and it may not tell the provinces and territories exactly how they have to achieve something, but it tells them what they have to achieve, and that's the first starting point. So what do you need to get to over the next 10 years? And then within the confines of your resources, within the specific challenges that may or may not exist in a given province or territory, you then figure out how to get there. So it gives you a goal and a target, and then the specifics of how to achieve that can differ across the country, but also we may find that having a national outline of how we should do this will help the provinces and territories figure out exactly what should be done. So rather than having each province sort of reinvent the wheel, we should work together, learn from what other countries have done, learn from the leadership the WHO has given, and then try to develop a plan that is specific for Canada, that addresses some of the challenges that we have to deal with, the huge geographies, the rural and remote communities, some of the marginalized populations that are priorities in Canada that may not be in other regions. Those are all challenges that we need to Canadianize a national action plan. We can't just take something off the shelf and apply it to Canada, but we also shouldn't let the fact that we've got different parts of the country be an impediment to developing a national action plan, because one thing I'm pretty certain about, we won't reach those elimination targets unless we start thinking nationally as a country, develop a national action plan which has all of those components, right from prevention through to treatment and follow-up care. Unless we do that all together, we're not going to get there. Treatment access is critical. You can't even think about elimination without really universal treatment access. And it's really important, and I congratulate the provinces that have broadened access within Canada, so that we now have a number of parts of the country where every single person living with chronic hepatitis C can receive treatment with funding from the government if they don't have private insurance, and that's hugely important. And I'm hopeful that the other provinces and territories that have not yet come on board will do that and match that level of support, because without access we can't even begin to have the rest of the conversation towards elimination. But I also want to just make the important point that access isn't everything. So access is the first step. You can't even think about elimination without access. But if you think that access is the only step, unfortunately that's also not going to lead to elimination. You need to build a whole public health infrastructure around access that involves screening, prevention, follow-up care, and the other determinants of health, harm reduction, and other things that go along with that if we're really going to get to elimination.